Well, while people are rolling in, I know there's a lot of familiarity for many of us, but not everybody knows everybody. So if you want to just go into the chat and say your name and who you're with, so people can kind of scroll through and get a feel for who's here. You guys got quiet. It must take a lot of concentration to introduce yourself on here.
To spell right too.
As long as you spell your name right, you can misspell the rest of it.
We're not grading the chats yet, so.
First
Dude,
meeting,
Jason.
you know.
Yeah,
Little
first meeting,
grace.
you're good. Yeah.
All right. Well, it's 5 after, so I'm going to get us rolling. Go ahead and keep filling in, in the chat, your name and what organization you're with. If somebody got a hold of the Zoom link, but you didn't register, you are more than welcome. We're happy to have you, but if you would somehow let me know so that I can make sure you get onto our contact list so that you'll know about the next meeting, that would be great. Other than that, I'm curious, just maybe a show of hands, how many people were here? We met in, I want to say October at OICA's Fall Forum, just to kind of get a feel for who might be interested, if there was interest in pursuing this. How many of you guys were here for that? Okay, a few, not a ton, but okay. So you may or may not have heard, or no, you may or may not be familiar with. If you were here, you heard it, but you may or may not be familiar with kind of the history of Count Me In for Kids. So I'm going to let Joe share a little bit of that with you. But first, those who are on our current leadership team, if you want to go through and introduce yourselves, I'll start. My name's Brandy Bynes. For those of you who haven't met me, I'm with the Lynn Institute. And I am trying to see the rest of you. I think I might just let you kind of pop up at will and introduce yourselves.
Go ahead.
Go ahead.
I'm Jennifer Abney, and I am from Angels Foster Family Network.
I'm Alice Jeffrey. I am a parent leader, and I'm the co-chair of the Parent Partnership Board for the state of Oklahoma.
I'm Clotilde Howard. I am the founder of Hope for the Future.
I think AJ and Joe are both on here. Are you here, AJ?
I am. I'm on the road.
She is.
And finally, this is AJ Griffin. I'm the CEO of the Potts Family Foundation.
Joe Dorman with Oklahoma Institute for Child Advocacy. And Brandy, if it's all right, if you're wanting to talk about the history of Count Me In for Kids, I'd rather defer to Karen Waddell. She was one of the co-founders.
Yeah, that'd be great because she definitely is more knowledgeable about it than probably the rest of us.
Including me.
Okay, so Karen, would you mind introducing yourself and then sharing the history? Do you mind doing that for us?
No, I'd be glad to. Am I muted? I can't find myself.
No,
now.
I hear
You're
you.
Good. Oh, okay. Welcome. I'm coming to you from beautiful Bartlesville, Oklahoma. I was fortunate and blessed to get to work with the Lynn Institute and the two organizations, and now I'm so proud to see you and Joe Dorman and all of y'all back together again. But in the how many years ago did we actually start, Joe? Do you have that year in mind? I should have pulled it up.
It was over a decade ago because I've been at OICA.
It was 2014, Karen.
2014. Yeah. Who told me that? Thank you.
Jennifer Abney.
Oh, hey, Jennifer. Jennifer was there. Susan Ogle was there. Joe, you weren't there. Steve was there. Anyone else on this call? Mary Myrick can't be with us this morning, but
I, I was there, Karen. This is Timothy
oh,
Tardibono.
Tim Tardibono. Hi, how are you?
Hey, good to
Haven't
see you.
seen you in ages. Um, 2014 was a really tough time for Oklahoma for kids. Our DHS numbers were skyrocketing, leading the nation, unfortunately, in the percentage of kids in custody. Juvenile justice was an issue, and overall, it was really pretty frightening. There was a concept that one of the issues we had was all these women that were incarcerated and leaving children behind. And so Sunbeam asked me to facilitate a program to try to develop a program for at-risk women who were going back to prison. And that became what is now the wonderful program of Remerge. And when I just moved back to Oklahoma, and my history was in healthcare before, and I'd run the Eckerd Institutes in on the East Coast. And when I came back to Oklahoma and I pulled all these people together, the folks at Sunbeam and many of y'all, Susan and folks, helped me identify who should be at the table. All of these people came in the room, and they were all the CEOs of these companies, these nonprofits that worked with the children and families of in Oklahoma. And my observation when they came in the room is none of them knew each other. And none of them knew how big the problem really was. When I asked the question, how many women are being incarcerated every year in Oklahoma, of which we led the nation, as you know, as the highest percentage per capita, I got answers from 400 to 5,000 a year. By the way, the answer was closer to 280, but they displaced about 900 children every year. And so from that, my observation was that there was, and by the way, DHS was not invited to attend at first because the relationships were so strained. And for those of you, I think Susan Ogle and Jennifer Abney will remember this. Remember what the DHS how they referred to the nonprofits? Remember what they called y'all? The name specifically?
I can't specifically.
I just remember, yeah, it was pretty business-like. Were we clients? I can't remember what it was.
No, you were vendors.
Vendors, that's right.
Yes.
And I kept looking
RFP vendors.
I kept looking for the vending machine. I'm going, what is this? But literally, and when DA did come to the table, the disdain and the tension in the room was obvious, and you could cut it with a knife. And the nonprofits were fighting among each other for any dime that they could get because funding was so terribly low. And what we said is, first off, we need to get to know each other and each other's programs and respect each other. And the only people that we should be mad about or have the right to be competitive with is anyone or any institution or any group that is in any way being unkind or intentionally hurting children and families. And those people, I put them on your prayer list, and we should all be working against them because that is not what God wanted us to be doing with this. And so what we did is we said, can we come together? And at first, people didn't even want to meet together. But as you can tell now, there are lifelong friends on this group, and I can see you all as you work together. But Mary Myrick and I said, let's try pulling this together. Wes Lane was one of the people we talked to. I just went blank. Team, the CEO of Team now. Somebody help me.
Chris Steele.
Chris Steele, thank you. See, when you get older, names go fast. Anyway, it took us about a year to come together, but by the time we did, when we were having our luncheon meetings, and we always had it where the luncheons were, at first the luncheons were given just to get people to come, we fed them. And then the beautiful thing happened is when the meeting was over, it wasn't over. People would come across the room and talk to each other, and they stayed and talked, and they planned. Remember that, Jennifer? Jennifer, would you or Susan want to comment on that and what that camaraderie was like?
It was really awesome. Like, we could solve problems in 5 minutes just from a conversation. We listened to each other's issues, and it was really, really nice. It was so awesome. And we had our meetings at Vineyard Foods, towards the end all the time, and they were so sweet to provide all the beautiful fruits and things like that after the lunch. I really enjoyed that time and being able to talk to other people doing work for kids.
Oh, that's great. Susan?
Well, I mean, I just remember being able to make some connections. I was at Positive Tomorrow's Inn and was able to make some connections with folks that I hadn't been able to connect with before. And that really benefited some of the kids that needed more help than just us could provide. So I think that's what it's all about.
And pretty soon DHS came along. They stopped calling us vendors and started calling us providers and friends.
And partners.
I think lifelong partners. We did some legislation. Safe Families was born out of the camaraderie that developed and the identification of need. And at first, DHS wasn't really a fan of Safe Families, and that camaraderie, that relationship, and that trust that was built. I think Safe Families is a wonderful program, just like I think y'all probably would agree with that today. But it was all about, I was so impressed when I came back to Oklahoma. Remember, I had not been involved in social services. I was a hospital administrator. When I came back after that experience of running the Eckerd program, what struck me in Oklahoma was that we are the one place in this country, I think, that has all the tools to create the best atmosphere for children. You know, the Tampa area where I lived in Florida has 8 million people, twice the number of people in the state, and they were working together better than what I saw in Oklahoma. And so then when we all started coming together and trusting each other, and by the way, in the voice of full identity, Roy Vineyard at Vineyard Fruits and Vegetables is my cousin. And so I leaned on him to give us free food, and it works. So thankfully, y'all are related to me, and I'm not leaning on you for doing things, but it was a real need. We needed to work together, and we realized that we did not have enough time or money or people resources to be duplicating. And some folks combined programs, some people gave up programs, and we were referring back and forth. So it was a joyous time, and I was thrilled to just be a part of it. And Mary Meyer extends her best. She just couldn't make it this morning, but thank you for asking, Brandy. It was or whoever, Joe, and then Joe Dorman. All along at OICA, we kept trying to find a home for Count Me In for Kids. Mary and I did, but our two institutions, Lynn and Mary's Public Strategies, really funded the majority of the work for just absorbed it for a couple of years because there was some administrative cost in the food stuff. But and we all sang Kumbaya and enjoyed getting to work together. And I'm thrilled to see all of y'all here. 57 people or so for a first meeting like this is pretty exciting. Thank you for asking, Joe. Joe, I didn't mean to take the forum completely from you. Do you have things to add now?
When I first started, I've been at OICA for 9 years and about 4 months. And when I first started, this was a great network for me to learn and to connect. Our main mission is working at the Capitol to see better laws passed that help each and every one of you. And so having a network like this helped me do my job better and hopefully in turn helped make things better for you all through policy. And so Count Me In for Kids has been wonderful as far as driving policy for kids in the state.
So it's so interesting, Karen, to hear you really give me a real good history because I've picked up here and there, from our notes and from people who were there, at the time, a little bit about the history. But just to hear you talk about, how DHS wasn't in the room at first. Oh. But then eventually they were, and people were coming together and talking about, what each agency or organization was doing and how they could work together and staying to talk afterwards, actually becoming friends. I often tell people when I try to encourage them to participate in Count Me In for Kids, I tell them, during the time that Count Me In for Kids was originally meeting, I was a stay-at-home mom and we were a foster family. And I didn't know anything about Count Me In for Kids. I'd never heard of it. I didn't know that there was any, stress or tension between DHS and the agencies or the attorneys or whoever else. I didn't know that eventually they came together and started talking, but I felt the change. I distinctly remember as a foster parent feeling that shift when my agency and DHS were now communicating and talking together better. So it might be a different kind of testimony than you've heard in the past about the effectiveness of Count Me In for Kids, but I did experience it even though I didn't know it existed.
That's beautiful. Well, I think the next generation of Count Me In for Kids is going to do even more and better things. And it is all about children and families. And when you realize how great the need is, but how much just any little effort can work to help the children and the families, it's all worthwhile. I just commend y'all, and anything y'all can do is wonderful. I'm very proud and happy for y'all to be here today. This is great.
Well, thank you for joining us.
Okay.
AJ, are you still driving? AJ was going to share a little with us just about kind of where the state is and kind of motivate us a little bit on why we want to be meeting. Are you available to do that, AJ?
I am. I am going to, I just got to my office. Just in case you're out and about, the highways are perfect, but the side streets are not. So not even close. So it took me a little longer than it should have to get here. All right, let me turn on my camera and get where you can see me. Hi, everybody.
Good morning.
Well, where is the state? Joe, you and I could probably tag team this one. I know most of you know, I think the one big number I want to talk about is 47, and that's where we rank with child well-being. That number has been what I would consider pretty stagnant for a very long time. We make 2 steps forward and 3 steps back. I was in DC last week with a group talking about just the impact we're going to see from HR1 and the changes in the Medicaid and SNAP program. I'm sure all of you saw yesterday. We have a new executive order around quote unquote welfare, which by the way doesn't exist, isn't a thing in the state. So we've got a lot of challenges. The other big challenge is having met with Senator Hall last week, the states, again, it's like it's 2014 again. It's ironic that that's when we first got started, because from a budget standpoint, it's not exactly the same place. The state has money in the bank now, but we are looking at big budget deficits and a trend away from investment in people that has been gaining steam for quite some time. So the sky is not falling, but it has shifted downward. And our numbers are just not good. And I think that's where we are. The other big challenge, although yesterday was for me, if you're on this side of this issue, was a great day. We handed in 200,000 signatures on an initiative petition to change our election process in the state. I think that's a big deal. It's a big deal for kids to have all the people elect all the people and have all the accountability. And every elected official have to answer to every constituent, not a select group of those constituents. So that was a positive. So that's one of the things I hope that we have. Advocacy groups tend to get myopic, and we're going to track bills that have the word kid or child or family in them and forget that this system is so interconnected, and transportation policy impacts the life of a child, and tax policy most definitely impacts the life of a child, and criminal justice policy affects the life of a child, and that it's all interconnected. So if we care about children and families, we care about the communities they live in and anything that impacts that community. So just a little update there. Joe, what do you want to add?
I met with Representative Pugh a couple of days ago. The state's looking at roughly a $400 million shortfall compared to last year. And so funds are going to be tight. We proposed a bill idea, and it's only going to cost $1 million to restructure the court system to provide better trained judges to handle juvenile issues. And even our staunchest supporters have said it's going to be a heavy lift this year. So anything dealing with money this year at the state capitol is going to be tough. And a lot of this is going to also tie into the one big beautiful bill that AJ discussed. Most of the uh, the programs within that have a starting date at FY27, and so we haven't even seen the financial impact of what this is going to generate. So we've been advising nonprofits. If you think it's bad now financially, if you're getting grants from the government or support from the government, it's likely going to get worse. Our state doesn't have the intestinal fortitude to discuss tax increases. They've done it once in a quarter century since State Question 640 passed. So it's going to be tough. And then you add on, Governor Stitt has said he wants state government to have fewer employees when he ends than when he started. And so it's going to be a wild session. And if you're not subscribing to our newsletter, you definitely need to, just to keep up with the weekly happenings of what's going on at the Capitol so you can be aware.
Okay, awesome. Thank you guys for sharing. So they're giving you a little bit of the policy side, but as we move forward, we really also want to have a good feel for what is it that families say they're needing, they're missing, they're struggling with. So we have started putting out a survey for families. So far, we've got, I think, 81, 82 returns on that. One of your action items after we're finished here today is going to be to help us get that survey out. But just so you can kind of see where that is right now, let me see if I can pull it up. Okay. Oh, that's not it. Hold on. I'm going to pull up for you the survey results. Let's see. There we go. Now that should. Okay. There we go. Are you guys seeing that?
It's good.
Okay. Let's see. Of course, I've got it. Well, my little bar at the top is covering up what I'm trying to see here. Let me see if I can. Oh, there it goes. The following areas. Okay, so the first question was the following areas that they were struggling with or needing support as a parent or caregiver. And you can see that neck and neck is they're saying children's behavioral or mental health and family financial stress, which there's no surprise on that one. Before I go further, let me tell you this. So far, just to give you some context, so far, most of the people who have participated in this survey are foster families with angels, excuse me, foster and biological families who've come to hope for the future. So we're really in the child welfare world. And I believe quite a few Sunbeam Family Services families have participated in this survey. So we do want to get it out more broadly, but just to give you some context to who's answering this. But so question number one, behavioral and mental health and family financial stress are the two big ones. We asked if they felt that the current resources that were available were sufficient. And quite a few did say sufficient. Just a little bit more than that said somewhat sufficient. Here are the actual numbers. So about 40% said somewhat sufficient. It's an interesting, I don't know, I'm a little surprised by those numbers. Not a ton are saying not sufficient, which is good, but it's interesting because as we progress through the questions, I don't think their answers necessarily jive with what they're saying here. Mm-hmm. So what services do you feel are currently unavailable or hard to access for children and families? Again, financial assistance and mental health is pretty high up there too. Here are the actual numbers. So a little over 57% said financial assistance isn't really available to them. And mental health services, we've got 35%. And you can see there the other categories we offered to them. Later on, we did leave some open-ended questions in case there was something we weren't thinking about that they wanted to touch on. So question number 4, what difficulties have you experienced when trying to access services for your family? Again, that theme of finances is coming up because cost and affordability are the biggest one. And then here, you remember a minute ago, we asked if they felt like services were available, and they said yes or somewhat, but here it's one of the top ones that they say there's limited availability. So, you know, we got to kind of make some interpretation on that, I guess. But here are the actual numbers. Another real high one right here was that they were not aware of what services were available. So almost 44%, and then the limited availability is about 46.5%. So I think that may be a big one, is that they just don't know what's available to them. Okay, so this was an open-ended question. What service or program has benefited your family that you would like other families to know about? So here you can see and these are not, some of these were listed more than once, but TANF, SNAP, New Beginnings, childcare, True Dads, that was listed a couple times. Good job, True Dads. Edwards Hope Center, Hope for the Future. Again, Hope for the Future and Sunbeam and Angels, they're all listed there. Those were the 3 agencies that really helped us get this out for the initial push. Bright Sky Ministry, Boys and Girls Club, Pivot, Family Expectations, Infant Crisis Services, WIC, the Care Center, Sooner Start, Millwood Early Learning Center, several said counseling services, Nana's Closet, ABA, GRG support groups. I'll admit I don't know what all of these are, and Parent Promise. So those were the services that this group said they were aware of currently. So then we asked them kind of a whimsical question, but if you could wave a magic wand and remove any obstacles or add any service or program, what would it be? Again, some of these were listed multiple times, but just a selection of answers. We saw them saying housing. So obviously we were surveying some families who were struggling with housing. Attorneys that can help other than legal aid. There's that financial assistance again. Ride program, a place to do supervised visits that's outside. I saw that a couple of times. Support for fathers, I saw that a couple of times as well. Funding or coverage for neurofeedback services to help kids heal from trauma, because we are learning that is extraordinarily helpful, but it's not funded. In-school tutoring. I also saw tutoring services, being able to have them at your home. Removal of stigma around foster or adoptive children and their families in schools and with providers. So this particular family felt like in the school and with the providers they were seeing that there was a stigma. And more access to affordable food and clothing. So there's that financial one again, in a sense. This goes on for a few pages because there was just a lot of interesting things that came out. Food assistance, mental health services for all children in custody during the entire process. That one I'm not sure about because my experience is typically mental health services are available for kids who are in state custody. But that's what they said. So apparently they're not aware of it if that is an availability. Allowing the child to live at home and have DHS check in at home daily. So I think they're wanting the child to be able to come home sooner. Mother and father group programs, more family services for parents with their children. So for the biological families with their children in state care, they want to have services where the children and parents can do the services together. Transportation / working vehicles, more programs for kids with ADHD, not having to relay paperwork to the primary care provider so that they could receive the services without obstacles. They're having paperwork problems, sounds like. Parent support and parent classes, jobs for young mothers, mentorship programs for foster and adopted adolescents, trauma-informed inpatient treatment options for kids, training teachers about bullying and about kids with mental challenges, legal services for grandparents and grandparents' rights, a provider to focus on families dealing with trauma and impacted by the justice system, and no-cost summer camp. So again, bear in mind, we have a fairly specific group of people who've been surveyed, and you're hearing that theme, I think, over and over. What other issues or concerns do you have as a parent or caregiver? This parent said, my child is in the top 3%, but I'm needing help providing tools for success on a low income. I'm concerned for my grandchild's social interactions and overall mental health going forward. Mental health theme again. Not being able to provide for my family / afford sending a child to college / financial stress. I put all of this on one line because we had several comments that were basically this. I'm concerned that the state is not emphasizing support for families with children ages 0 to 4. Places for kids to go that are free or low-cost activity. Co-parenting and scheduling, I guess, it's an issue they're having. After-school care and help paying for sports and activities. Need cost of living increase for foster and adoptive kids. Feeling tired. We went from caring for 1 grandchild to 4 under the age of 5. And that's actually becoming increasingly common. Being notified when services are available and given enough time to respond. Oh, okay, I guess I only did one screen for that. On that one, the rest of the comments were largely financial stress. So, and then we just did some demographics. So just for your context, you can see most of the people who responded to the survey were women, 80%. The age was primarily 25 to 34. So you can see the numbers there, the breakdown. Race or ethnicity, let me give you the exact numbers. So about 40% were white, 32% Black or African American, and then it broke down a little bit smaller from there. Okay, this question we asked, how many children age 17 or younger do you care for in your home? Now, you'll see that this is a parent and caregiver survey, but you'll see that we've got the green bar at the top says none, and there were several people that responded with that response. Mm-hmm. Here's what we found out. Clotilde at Hope for the Future helped us figure this out. What was happening was if biological parents were taking this survey, but their kids were currently in state custody, then they were saying, I'm not caring for any kids in my home. So we added, underneath the question, we added, if your children are currently in state custody, please indicate how many of them lived with you before they were placed outside your home, so that we could kind of get around that problem. But because we did have several people take the survey, let me give you the numbers. Before we added that little bit in parentheses, we did have almost 13.5% say none. So nobody was actually taking this survey who was not caring for children at some point. Just so you understand.
Also, kids in foster care who are older than that, who have aged out of the system. These are families who have kids in college. Some of our foster families that answered it went out to everyone, and they may not have a placement at that time, or the child's in college or over 17. Just FYI.
That's helpful. That makes sense. So there's some context for everybody. Which of the following best describes your current relationship status? Most were either married or single. Here are the actual numbers. Actually, married and single are exactly the same right now for who's taken it so far. Okay, that was the end. Now, how do I get out of this? There we go. Let's see. Well, I'm not sure. Stop share. There we go. Sorry, guys. I have been in a ton of Zoom meetings. I don't facilitate a lot of them. So, all right. So that was a whole lot of information. And we want to give you guys a chance to respond to the information. So, do you have thoughts, questions, or about anything we've said up until now? We just want to kind of open the floor.
Brandy, I did want to share some of the comments, and some of you weren't there at our last meeting, but on one of them, I believe that some of the parents, they didn't want to take they couldn't take the survey due to them having a government phone. So I wanted to bring that out too. So that was an issue that they didn't want to take it. Then I had some parents that, even though they had a phone that they could have used, they didn't want to take the survey. And I don't know if it's because they didn't want that. And I told them it was anonymous, but they still chose not to take the survey. And also on number 9, where it says if both parents attend the visits, only one can put. So if both parents can attend the visits, only one person can put their age. So I don't know if that would make a difference or not, on that survey. So I just wanted to. I don't know. That's what I noticed as well.
I'm sorry, Clotilde, explain that to me. Only one person could put their age?
On number 9, let me look at number 9. What is your age? So if both parents
they were
the
taking it
survey,
together.
yeah, they could only just put one individual's age. So I don't know if that make a difference, but I just want to bring that to your attention as well.
Okay, that makes sense.
And I think that's all I had to share.
No, I'm glad you brought that up, Clotilde. So as we try to get this survey out, that is a difficulty that we've discovered, is that sometimes when people have a government issued phone, they were having trouble being able to access the survey. Now, at Hope for the Future, they were able to get around this they have tablets, iPads that they could let them use. Right. But if we put these surveys out, it's currently being done on SurveyMonkey. So if we put it out, posted it in various locations, if somebody has a government issued phone and they can't take the survey, I'm just not sure. Does anybody here know details about that? Because we did have somebody with a government issued phone who told me that they were able to use the link.
Really?
Yeah. So I'm not sure. Does anybody have insight into that?
I used to work for a Lifeline phone company. Some of them block it, some don't. It depends on the plan. If they have internet service associated with the phone, because clicking on the link takes you to the internet. So it just depends on what the company allows and what the service provides.
So, Joe, do you happen to know then, this was something that I think some of us talked about, with the survey currently being on SurveyMonkey, would it likely be more accessible to a larger group of people? Would more phones allow them to access if it was like a Google survey? Do we know?
Don't know. SurveyMonkey shouldn't be one of those things that's blocked intentionally as a government protocol. Okay. So. Okay.
And Brandy, one more thing I wanted to make note of. Some parents, and I actually had to sit down and fill this out with a couple, 3 or 4 parents, because they were not able to understand the questions. They really weren't. And as far as reading, their reading ability, or they just couldn't understand something. So that has been an issue here at Hope for the Future for a couple of parents.
So that's another good point. And I think Clotilde and I discussed this, we might need to consider as a group, forming a little committee or something to go out and do some listening sessions, to actually verbally go through the survey and just, count hands, take notes, and let people talk to us. Are there thoughts on that?
Well, there's a structure that already exists
to gather that information through parent advisory committees, the state level PAC at OCCY, and then all of the family resource centers across the state are required to have a parent advisory committee. And so there's a network that it would be fairly easy to get that information from.
Okay.
And I know Joni Bruce isn't on here. We need to get her involved with Oklahoma Family Network. I mean, they're experts at that type of stuff and with the statewide presence.
Okay. Yeah, that's great. I'm making some notes here, AJ. And I'm looking at the chat.
Also, the CISO is working on developing a statewide youth advisory committee. So I will make sure that I pass this information to Marina, who is in charge of that. So yeah.
Great. Committee, right?
Even though it's probably not suggested for people to take photos of QR codes on billboards. The attorney for Lamar Advertising used to be on my board, and I could ask him if we could get some space on some of their digital billboards to put something up if you wanted to reach a broad-based group.
Who is that, Joe?
The attorney for Lamar Advertising, the billboard company.
Oh, okay. Oh, wow. Okay.
They always need something for community service, so I could get them to make that as a donation to OICA.
Amazing. Okay. Great. That's really great because, one of the things that I've really been thinking about as we've tried to get this survey out, yes, I want to hear from foster families. Yes, I want to hear from, all the families that I'm familiar with. But I really want to make sure that we get this survey out to the community at large, and particularly to some of those lower income families who are struggling. They're needing the services. They don't know where the services are. To really hear from them, what is it that they're needing? How can we find them? How can we meet them where they are? How can we let them know what services are available? And just give us a better understanding of how to move forward most effectively for all of the kids in the state, not just the ones that are actually probably doing a little bit better. Does that make sense? That's probably a really inappropriate way to say that, but.
And also please make sure that the survey is in Spanish. Sometimes, the state will get some surveys expecting that the browser will translate, and not always is the best translation. So if you can we work with that, because it's important. I think that more than any other time, the community will need these services, the Hispanic community, with all the eyes taking the parents and everything. So,
okay.
And I'll take it one step further. We have a large Vietnamese community here in our area, so the more languages, the better.
Hey, Brandy, approximately how long does it take to complete the survey? I'm wondering if I could maybe work that into just my routine when I'm doing
it's SurveyMonkey says it takes about 4 minutes.
Okay.
It's really brief. Okay. I'm going to look here at some of our comments. This aligns, okay, so the survey, it sounds like the survey results, it says aligns with what parents are saying at parent cafes as well. Okay. This aligns with what I describe as phantom services. They're available on paper, but not in practice. I see this a lot around mental health services for children when making referrals or helping with navigation. Okay.
Brandy, one other group, this is Susan Ogle. One other group I think is to figure out how to reach our homeless parents, because they're really outside of a lot of the normal avenues, whether it's reaching out to some of the shelters or something like that, to see if you can get some kind of sample from folks who are homeless.
Okay.
Daryl will be able to help with that.
Yeah, that'd be great.
Yeah, Daryl is definitely our in with that, and I I've suggested that we perhaps post the QR code in the waiting area at the family court system and over at the juvenile office as well. And I think that it should also be available at shelters. I think that would be another good spot to pop just like a flyer in, just so they can have the opportunity.
Nice. Okay.
I think that it really beneficial if case management, when they bring the families into a shelter situation, that they could put out this survey.
Yeah, I like that. Okay.
I had also suggested like the welfare office where they're getting food, applying for food stamps, and yeah, the food banks and the WIC offices would also be a great place to make sure that we are hitting those parents that are already receiving some assistance, because indication is if they're getting one kind of assistance, they probably need all kinds of assistance.
For sure.
Also the family tree. If you get it over there, we have visitation with parents that come through there.
Okay, family tree. Great. Okay. Let me go through some more of these chat comments. We have two incredible people present today that are moving the dial on children's mental health, since that was a recurring theme. Cindy Lee and Angela Hine from Impact 405. Cindy has changed outcomes for thousands of kids through the Halo Project. My family can attest to that. And Angela started an incredible project to create a direct website for anyone needing to link to systems of care in Oklahoma. Yeah, so once Impact 405 has their Oklahoma Resource Hub up and running, that will be an amazing resource that we can start sharing with families and get the information out there, because it's going to be set up so that, Angela, are you here? Do you want to talk about it for a minute? Did she have to leave us?
No, I'm here. I'm here, like not visually though, but
Okay.
I'm here. So our primary project with Impact 405 has been the Oklahoma Resource Hub, and we started that process in the conversation of it, the development of the idea in May of 2024. And then this year we were able to actually complete the development of the platform itself through a small ARPA grant. But the idea, we're not necessarily reinventing the wheel. We're just kind of reinventing what the wheel looks like and how it functions a little bit. What we have experienced, what I've experienced personally, I had some lived experience as a child and needed access to resources and was not able to find what I needed when I needed it. And what I found is that it hasn't changed a whole lot since then. We have more than 20,000 nonprofits in Oklahoma, and we don't know who they are. Nobody knows. Nobody really has a good understanding of what exists. And when we think about resources, I think we typically think about food, clothing, shelter, but there's so many other resources out there as well that we just don't even think about. But with the Oklahoma Resource Hub, it's designed to be within a few clicks. You should be able to find what exists. So we're in the data phase of that right now, but you're able to visualize the platform if you want to take a look at it. Just please don't share it publicly because there's not enough data on there, but it's oklahomaresourcehub.org. So we wanted it to have a good visual component so that when users are interacting with it, it's easier to understand where to click, what to do, and have a really good descriptive understanding of what each program is offered from every organization. I know that was a very wordy answer, and I apologize for that, but so the goal is that we'll know what all the resources are. We'll be able to see the gaps in resources easier and be able to empower the community to connect with those things and make it easier for case managers to connect their clients as well. So Yeah, I mean, there's a lot more that could be said, and I could probably say it more eloquently with a little more
Sorry,
preparation,
I
but
caught you on the spot.
yeah.
No, that's good. Thank you. Okay, other thoughts, questions about the survey, not about the survey? I see several people in the chat saying if we could get the survey to you, you could get it distributed, which is exactly what I'm hoping for. And I will be sending that information to everybody after the meeting today.
Brandy, I think for the care center, I think that you will probably have to send a direct email to our CEO for that.
Okay.
And that's going to be Hillary at thecarecenter-okc.org. 2 L's.
Okay. Somebody's asking, what is the goal for the number of completed surveys? Good question. Do we have thoughts on that? I think as many as we can get. I think maybe we need to have like an end date goal, which we're going to talk about this in a minute, but we're hoping to have these meetings about quarterly, which would mean the next one we have scheduled for April. So if we could have all of the results by then, for sure.
I mean, this is a survey. We could, say we send it out every year, and maybe they could respond to the changes, positive or negative in the areas of concern or something like that as well.
Yeah. What else? Are there any other thoughts on what you were expecting Count Me In for Kids to be kind of focused toward or hoping maybe? Because we are asking the parents to find out what the needs are, but you guys are in the industry and you see firsthand what some of the needs are as well.
I have a echo here. Right? Sorry. Okay. Right. I'm gonna type it in.
Yeah.
Brandy, may I share a minute about the survey?
Of course.
And this is Karen Waddell. I will find material. I apologize. I didn't provide a better summary today of how we really started, but Steve Petty and Tim and Susan and people will remember we tried survey. What we really concentrated on was doing the other part, which was identifying what services were available. And that was very, very difficult. And we didn't have it looks like you're going to have a wonderful way to distribute what resources are available. But the issue with surveys is always that the constituent who completes a survey, then their expectations are raised that something's going to happen. And so I think as you all work through this, I would encourage you to think about how you're going to do that. And then real quickly, the other thing that we had at the table, and I don't know if you have anyone at the table who's coming regularly who represents mental health and general health care field, but we had FQHCs, we had Variety Care, we had North Care, we had foundations at the table who were there to say, hey, I'll fund this kind of a survey or whatever it is. But I think when you think about this, the survey is important. But sadly, and Tim or Joe or somebody help me on this one. I don't recall our exact numbers, but I can tell you that the results of this survey are not that different from what they were 15 years ago. That's the sad thing. And so how you address with that, I think that the survey is important, particularly if you can do it by geographic or by location, then you'll be able to target the resources needed to those groups. But I think the need is to identify, to provide the services where they need to be provided. And I think y'all sharing and working together are going to do that.
Thank you. And sadly, I guess I'm not too surprised that the results aren't very different than they were all those years ago. But you're right, that does really point out, how do we then move the needle if, things aren't changing, didn't change in some of these areas? How do we get that information to the people who need it? Definitely, I would love to see some of these other types of organizations and agencies that you're mentioning at the table. So that is, please, to everybody, invite, if you have contacts, please invite them.
Enid Much was there, Pat Potts was there, David Green from Hobby Lobby gave us $100,000 to help kick off everything. We reached out to everyone to try to identify how we could do, but it was primarily to build this group. But I think this group is so much larger now. There are so many more organizations working. I think you all have a lot of the tools to be able to move forward. In Sarah Roberts was one of the key people coming, and all the foundations, and we had the CEOs from the nonprofits were there, and I think that helps too. But I think this is a great group. I'm thrilled. I'm delighted that I lived long enough to see this.
Thank you.
And Steve Petty Steve, you may have some remembrances of the surveys, and I had staff people that were ready to kill me. The surveys were, so remember the difficulty in trying to compile all that?
I do. And Brandy has a lot of that. I've given her all of the historical data that I could find, but you're right. The same thing, sadly, all this years ago. But you got to think about, in the meantime, what had happened. You guys did so much, that original group that did so much, and that there is this much positive, for people to do this again and for this group to come back together. I mean, it's just amazing. And like you said, to have all of these different types of organizations involved at this initial startup is just amazing. And I just appreciate all of you.
Oh, I did want to also say, Karen, you were talking about trying to figure out, what's being said in each pocket or each, area. And I did not list this just because it would have taken me a minute to compile it in a way that made sense. But the end of the survey does also ask zip code. So we do have a sense for, we will be able to have a sense for where some of these, families are living when they're listing what they're struggling with. So we can definitely put that information to use as well. Okay, Madison was echoey, but she put some things in the chat. So let's see. She said, I see a lot of parents struggling with mental health while also struggling with their child's mental health, behavioral health. So their own mental health as well as their child's mental health. Okay. Kelly Clark at Positive Tomorrow says, our parents also struggle with mental and behavioral health. Halo can help with that. Yes. Thank you, Cindy. Limited access to affordable adult mental health care has a direct ripple effect on children. That's something that we haven't talked as much about. Yeah. That when parents and caregivers cannot get support, kids often carry the weight of that gap. That's a little less direct than I had been thinking, but that's absolutely huge and true. If the parents are struggling with their mental health, that obviously has a very direct effect on their children. I see DHS foster care director Michael Williams, very excited he's joining us today. Oh, good. I'm glad he's here. Welcome. Let's see. I worked with the housing authority communities, and I also see children struggling with behavioral and trauma. Okay, good. If you know somebody from OCHA, please invite them. I see a lot of parents struggling with housing. Okay. At Sunbeam, we do have mental health services for pregnancy through the lifespan. We also have a newer program that supports pregnant moms and young families with children up to age 3 that has case management built into it to reduce postpartum, along with a housing specialist built into the program. Okay, that's very comprehensive. That's great. So I think what some of these comments are showing us is that the resources are available, right? You guys are available. You have the keys. You have the tools. So as we continue these surveys and discover what the families are really saying that they're needing, then I think that the challenge then maybe is how do we let them know what services are available? How do we give them access to the services that they need?
I've been working on a little project to where being with lived experience from homelessness and witnessing those barriers that come along with it. I've been trying to figure out how we get outreach and governmental subsidy phones together to have a representative of a subsidy phone company to go out with an outreach team on the field and bring these phones preloaded with all of the resources that they need. And with being in this meeting, how could we somehow integrate the survey into some type of these things that are being already preloaded into these phones and handed out to these individuals so they don't have to seek out a governmental subsidy phone and try to get all of those resources? How can we get that and possibly the survey out to the field?
And do you have a contact or a connection to try to make that happen?
I'm doing all this as we speak. This is just in the works. I've been working on it for a couple of months now. So, and if anybody else out there has any ideas on it, I mean, this is something that I'm getting in touch with subsidy phone carriers right now and outreach teams to see what we can do to get this started. But I think that if it comes off the ground, that it would be very beneficial to the homeless community.
Amazing. Okay. I'm going to reach out to you specifically, Daryl.
Okay.
Thank you for that. Okay. There's a question. Oh, great. Awesome. Sorry, the questions are rolling in fast and it's scrolling past me. Okay. Questions are being answered in the chat. Good. Okay. Other thoughts? Other questions? I'm seeing a trend here in that communication and easy access to services is our major roadblock. And we have an incredible opportunity to focus on this through the Resource Hub. I do see the incredible work of each one of you out in your community. I agree. Parents are struggling with their children's behavior during visitation. Frustration from the parents of not knowing how to help handling situations. At times, I've gone in to assist with the caseworkers, more training in TBRI. Yeah, that'd be great. Okay. All right. So I think the wheels are turning, and we do want to go ahead and get these surveys out to a broader group of people. We have some avenues to do that. So, Clotilde, do you want to go ahead and give them their action items? You're muted.
The action items you listed on this agenda, what we didn't
Yes,
talk
ma'am.
about?
Yep. Do you have it?
Getting the word out.
Yep. Getting the word out about Count Me In for Kids, so we can get more people at the table. You want me to do it?
Yes, I mean, you just. I mean, I didn't.
I got it. Okay, so this is what we're asking of all of you. If you will please get the word out about Count Me In for Kids, get some of these other agencies and organizations that were brought up today. If you have a contact, please invite them. We need your help distributing the survey. And we've talked about a lot of different ways to do that, a lot of different places. And I will send that to everybody this afternoon so that you'll have the link and the QR code. And then we also want you to know that our next meeting is scheduled for April 15th. Just like today, it's from 9 to 10:30. I know it's tax day. Have your taxes done so that you can join us. And it's going to be at the Crossings Community Center. So we will also be putting out information about that. I will send it to you through email, and we'll also have it on social media. Can you or someone from Lynn present that to the Community Resource Collaborative in person on February 20th? Let me check my calendar, Angela. Let me write that down. February 20th. Okay. What else? Anything else?
Thank you, Brandy. I wasn't aware that you wanted me to share all
Sorry.
that. That's just
I'm
like,
sorry, I wasn't very
He
clear.
threw you
Clotilde.
under the bus, Clotilde, right in front of everybody. Right in front of everybody.
yeah.
Welcome to my world. Welcome to my
Oh, okay, Steve.
She just put me on the spot just like that.
I'm sorry, I wasn't very clear about that with you. No worries. Okay, so those are your action items. I'm going to put my email address in the chat in case you need or want to reach out to me for anything. And other than that, thank you all so much for coming. Thank you for being flexible when we had to pivot at the last minute. And I'm just really looking forward to seeing where this goes. As we gather information, I think we'll have a better understanding of what we want to do next and how we want to actually put things into action. So thank you guys. Stay warm, and you'll be hearing from me this afternoon through email.
Thank you, Brandy.
Thank you.